Hello, and welcome to the spotlight session of the 2024 Healthy Longevity Global Innovator Summit. My name is John Cowart, and I'm the CEO of Outlier Technology. And it's an honor to have the opportunity to share with you a glimpse into our work and some of our fundraising efforts. Our company won a Catalyst Award last year in 2023 for the development of NeuroSync, which is basically an augmented reality neurorehabilitation platform of music therapy-based games, puzzles, and exercises that aim to stimulate neuroplasticity and prolong functional independence in individuals with Alzheimer's disease. And more recently, just a couple of weeks ago, we were informed that we'd be receiving the 2024 Catalyst Award for our development of ChronoSense, which is a desktop breathalyzer for breath-based biomarkers for Alzheimer's disease diagnostics. Now, on the surface, these two innovations might seem sort of miles apart, even orthogonal, but we really believe they're actually quite complementary because the medical field is increasingly coming to the conclusion that the earlier Alzheimer's disease is able to be diagnosed and recognized, even at the preclinical stages, the more likely future treatments will be able to have increased efficacy. In particular, with our approach for neurorehabilitation and stimulating neuroplasticity, we believe at earlier preclinical stages of the disease that that making the brain more adaptive has a better chance of counteracting some of the neurodegenerative effects of tau fibrils and plaques and so forth that disrupt some of the functions of the brain. Now, these two different innovations are facilitated by a team with distributed expertise in the STEM field. So we have technical backgrounds, all of us at our core, but we're also musicians, artists, and creatives. So there's sort of a distributed expertise between the creative side and the technical side. And in addition to that, on a personal note, all of us in our families have been impacted by neurological disorders such as Alzheimer's, strokes, and autism. So we're really highly invested in developing solutions for some of these challenging medical problems where we believe traditional medical approaches have seen somewhat limited success. And we're also really interested in sort of combining the collective spectrum of our core competencies to develop new and innovative approaches to developing technology for healthy longevity. With respect to some of our work with music-based neurorehabilitation, we're really interested in, I guess you could say, advancing the science of music and also developing technologies that blur the lines between therapy and art. So our interventions should not really necessarily feel like laborious sort of technical probing treatments, but rather something that's engaging and fun and interactive. Now, with respect to NeuroSync, one of the things that we're quite interested in doing is helping the brain become more adaptive and targeting mechanisms of neuroplasticity that enable the brain to have a neurochemical environment that stimulates neuroplasticity. And then once the brain is more adaptive, coupling that with treatment approaches that are personalized to the individual and their needs, their medical needs, and sort of their capabilities, and helping them basically prolong their functional independence with interventions that adapt to them. At the core, I'll just back up. So one of the at the core of what we're doing is really leveraging sort of the neuroscience of music and the fact that it's really well known that music stimulates heightened neural activity on both hemispheres of the brain and disparate regions of the brain. So processing music really sort of stimulates and activates the brain, which is really useful for us. But that heightened brain activity happens whether you're passively listening to music or actively creating music. In either case, if you're just listening to the radio or if you're like actually making music, your brain experiences heightened neural activity. But that heightened neural activity doesn't necessarily translate into heightened adaptivity. In order to make the brain more adaptive, a little bit more is needed, and one must actively be in the process of actually creating music to leverage those benefits. And specifically, that's because after the age of 25, the process of neuroplasticity, this neurobiological phenomenon, is gated by the brain's release of epinephrine and acetylcholine. Epinephrine is a neurotransmitter that's typically associated with alertness. It's basically adrenaline. And acetylcholine is the neurotransmitter associated with focus. And that's a sort of make intuitive sense because like once you're an adult, if you want to learn something, the process of learning is basically your brain becoming neuroplastic and being adaptive. You can't be sleepy and unattentive. You have to be focused and alert to learn something. And so this process of neuroplasticity being gated by these neurotransmitters allows the brain to actually be adaptive at any age. There are other mechanisms for neuroplasticity that we aim to leverage. One is dopaminergic transmission, which is basically essentially reward incentivization. And the other are proprioceptive vestibular mechanisms that basically allow your brain to calibrate new movements relative to gravity. If we combine all of that, basically, we come to the conclusion that interventions that integrate active, movement-based, goal-oriented music creation activities prime the brain for learning. And we're really interested in leveraging this sort of neurochemical environment where the brain is more adaptive, and then integrating that with interventions that are designed from the bottom up to not only treat the patient's clinical sort of therapeutic needs, but also to collect data that allows us to use machine learning to progressively adapt the interventions to the patient's evolving sort of medical condition and also their health and longevity goals. And with that, I'd like to share just a kind of a quick example of some of the interventions that we're developing with NeuroSync. At its conclusion, it will have 12 different interventions, but this video will show about 4 of them. At one of the core elements of what we're developing are sort of augmented reality therapeutics that utilize computer vision to track the human motion and allow the user's movements to interactively engage with music so that there's sort of a real-time sort of responsivity with the music that they're engaging with. The brain interprets that as them creating the music. And we believe, or at least we hypothesize, that this will help encourage the brain's release of epinephrine and acetylcholine for alertness and focus. So those are just 4 examples of early prototype games that we've recently feasibility tested in a study, in a human study with our phase 1 SBIR. And with respect to fundraising, we're pursuing a diversified, non-dilutive funding strategy that's really driven by understanding the customer's needs and also the traditional limitations of medical approaches. Now, the customer in this case, you might imagine, is distinct from the actual end user in some respect, with the patient being considered the end user, but the customer obviously is not going to be somebody that has Alzheimer's. They're going to rely on a caregiver or a family member. So we've been working really hard to try to develop a platform that's not just designed to meet the end user's needs, helping them with improve their functional independence, but also making sure that the platform is designed for the people that would be administering this intervention at home, and sort of bridging the gap between therapies that are traditionally administered in clinical settings and those that can be administered at home. Well, with respect to fundraising, we've been working hard to raise money with grants and awards, such as the Catalyst Award, and also SBIRs, which are Small Business Innovation Research Grants, primarily through the NIH. And also, we've been doing a lot of grassroots funding. I've been street performing with live demonstrations of our prototypes to kind of get the community involved and to make people more aware of what we're doing in the San Diego area. One of the cornerstones of Outlier's funding strategy is actually de-risking our technology through 2 rounds of clinical trials prior to bringing on outside funding from investors. And to do this, we've been pursuing research grants through the SBIR program at the NIH. And there's a couple of really beneficial aspects of applying and receiving SBIR funding. The first we found is that the SBIR process has helped really refine a lot of our ideas from the conceptual stage where, we think we have like a really great idea, but because it is still a lot of times a new idea, and at least in the beginning stages, there are lots of holes in it that, we're just unable to see because of our own technical blind spots. So going through the SBIR process and having our proposals reviewed by area experts has been really, really invaluable for helping us sort of refine and polish our ideas and to make them a bit more robust. Also, if you get an SBIR award, there are generally other sources of funding that become available for you after that. And one such award is an administrative supplement. And we were lucky enough to get one that helped us expand the goals of our phase 1 R&D. And also there's supplemental support from the TABA and ICOR programs, which is essentially augmented our ability to do market research and facilitate customer discovery. All of that together helps us de-risk our technology from proof of concept through pilot study, which we hope to conduct in phase 2. And then the NIH also has phase 2B funds where we would hope to do our first large scale clinical trial. We believe de-risking the technology through this grant process makes us more attractive to investors for a potential liquidation event, and also helps us gain credibility by winning these awards to attract new talent and strategic partnerships and new hires, which is really important for making sure the right technical expertise is available to ultimately create the best product. Our funding strategy also includes diversifying grant submissions across agencies and review panels to improve our chances of getting scored and funded. The first part of that is making sure that we get scored, because if you don't get scored, you basically have a 0% chance of getting funded. So we try not to put all of our eggs in one basket. The NIH has 27 institutes and centers. We typically apply to any given funding round between 5 and 6 of them. We have a sort of a rotation of proposals that we've been developing over the past 4 years. And we also try to strategically and carefully select our study sessions so that no 2 of our proposals wind up being reviewed by the same reviewers or even in the same review panel, where they would essentially be in competition with one another versus other applications. We believe this, at the end of the day, helps improve our chances of getting funding. And for those of you who are in America who are able to or interested in submitting SBIRs, the PHS form is really useful in helping select and identify reviewers and review panels that you would like to target for your proposal to be reviewed. Another really key aspect of our strategy, it relies on being really receptive to the feedback that we get at every step of the way in the review process and continuously integrating that feedback into future submissions. And I'd sort of like to break this down to 7 parts. And this is, again, based on feedback that we've gotten from submitting lots of SBIR proposals and discussing our review process with key players in various divisions of this review process. The first thing that we do is we look for funding opportunity announcements with budget waivers. So there's tons of funding opportunity announcements. A lot of them are available in the omnibus, but there's a separate document where the NIH and each individual agency lists their high priority or special topics. And these topics generally have more resources available because the institutions consider them their priorities. So they prioritize how they spend their money on SBIR applications that are awarded funding. The phase 1s with larger budgets also tend to have larger budgets for their phase 2s. So with respect to raising money, just for a practical issue, if you're trying to take your innovation from concept to product stage, the more funding you have along the way, the easier it is to accomplish that. So In particular, we look for grants from the outset that have larger funding opportunities. Next, we're very proactive with speaking and engaging with our program officer. It's important to make sure that you can confirm their budget priorities. So they'll let you know, like if you have a proposal that you would like to submit to them, if it's something that they would consider funding or not. And generally, they'll give you approval to submit their proposal to their division. Actually, it's like quite pointless to submit a proposal to a particular division if they tell you that it's not within their budget priorities, because even if it scores well, if it's not in their priorities, they're highly unlikely to fund it. So we recommend really engaging with the program officer and understanding what their priorities are. They'll also give recommendations on the study sections that you should target, and also ways to address some of the reviewer comments if you're doing a resubmission. The POs or the program officer are really advocates for the applicants. So they're there to help you and sort of guide you through the process. And I've found personally that they've always been really helpful and really useful to engage with. Next, it's a great idea to identify the best scientific review panel for your proposal. Ideally, you would like to identify a proposal where there are experts that are in alignment with the primary research thrust of your proposal. So your proposal, let's say your application, in our case, we're developing software that uses computer vision for health related issues. So we're really looking for a review panel often that has experts in computer science and also experts in health, because we believe that our proposal is more likely to receive a fair review if the experts have expertise in the areas where our proposal is most highly aligned. Next, I'd say is probably one of the most important aspects of how you craft a proposal, and we've sort of developed this from speaking to several POs about proposals that tend to get funded in the departments. And basically, you want to craft your proposal with a narrative that speaks to the four archetypical types of reviewers. Those are clinicians, scientists, engineers, and business experts. And they each want to know something different. The clinician wants to know, how will your technology be used in a clinic or in the real world? The scientist wants to know what your hypotheses are, what are your experiments, your variables, your conditions, possible interference or confounding factors. How will you validate your hypothesis? The engineer really wants to know how you're going to build your technology and if you have the right expertise and distribution of expertise on your team to do so. And the business expert really wants to know how you're going to sell this technology, who wants to buy it, how you commercialize your innovation. We also really recommend that you leverage the supplemental documentation window, which is basically closes 30 days prior to the review panel. This documentation window basically lets you submit up to 2 minute demo videos and a page of preliminary data. We found that it's another way to sort of reinforce our messaging, and often reinforcing that through audio and visual means is more effective, or at least complementary to a lot of times what we have in the written proposal. Then after the proposals are reviewed and we get back the comments, we always study and organize our reviewer comments. And this helps us to identify trends and themes in the reviewer critiques, which is really helpful for helping us identify areas of improvement and revising our proposal accordingly for resubmission. One thing I'd also like to mention is, if you believe your idea is good, don't get discouraged if you don't secure funding on the first submission. It's actually like pretty rare to get funding on your first shot. We'd encourage you to use feedback, or the feedback from the process, as a tool to continuously improve your idea. And another sort of final aspect of why we believe the SBIR process has been really helpful for us, it's allowed us to develop ideas and really refine them, and then sort of use those ideas to apply for other awards. And this was particularly instrumental in helping us get the NAMM Catalyst Award. The two awards that we got were based on ideas that had already been through the SBIR process, maybe 3 or 4 times, something like that, 3 or 4 different revisions. So by the time we got the NAMM prize for the 2 that we were selected for, these weren't raw ideas fresh out the box. These were ideas that had really been sort of polished over time. And with that, I'd like to thank you for your time and attention. If you're interested in learning any more about our technology and what we're developing, I'd like to direct you to our website, outliertechnology.com, or our Instagram, Outlier Technology. And I'm happy to answer any questions if there are any in the audience.
Thank you so much, John. We really appreciate it. And thanks for sharing this great PowerPoint with the videos, and we'll make it available to folks. We really enjoyed hearing about your strategic approach to how you go about applying for funding. I think it will be really helpful for many of your fellow awardees and others considering how to apply for grant funding and the approach they should take, even if they're working in different disciplines. So congratulations again also to you and your team at Outlier Technology for the 2023 and now 2024 NAM Catalyst Awards. We're very excited to have your team back as a repeat winner and learn more about your next project in the future. So thank you for being here.
Thank you.
And for all of your guidance.